Hello, and welcome to One World, One Health with bite-sized insights from people working to solve some of the biggest problems facing our planet. I'm Maggie Fox. One Health means we're all one: animals, plants and people, and the climate and environment. Sometimes it's hard to show this, but a team of scientists has done the hard work to demonstrate just how complicated these relationships can be, and just how big the payoff can be when you recognize the links. They looked at the Amazon. This 7 million square kilometer region of South America is the most biodiverse place on the planet and has half the world's surviving tropical forests. Most people know that saving these forests saves the animals, plants, and other life in them, and that preserving the rights of the indigenous people to live there saves those people and also life in the region. But this new study shows something more. Preserving the legal rights of the indigenous peoples of the Amazon region saves the lives of the other people living in the countries linked by the Amazon: Peru, Brazil, Colombia, Venezuela, and elsewhere. That's because when you stop the destruction of the forest, stopping the burning, the mining, the clear-cutting of the trees, you also stop the pollution from smoke. You limit the spread of insects that carry diseases, and so you improve the health of people who live in areas outside the Amazon. In this episode, we're chatting with Dr. Júlia Rodrigues Barreto of the Institute of Advanced Studies at the University of São Paulo in Brazil, and Dr. Filipa Palmeirim of the Federal University of Pará, Brazil, and the Free University of Brussels in Belgium, who led the study team. Júlia, Filipa, thank you for joining us.
Thank you, Maggie. I'm happy to be here.
You've done some important and interesting research that shows that preserving forests for the indigenous people who live there in the Amazon helps keep the people elsewhere in those countries healthier. Can you tell us how?
Yeah, that's great, right? We did. I'm so happy that we did. And all the study started by thinking how many important roles indigenous people play on the environment and biodiversity and stopping deforestation and a lot of things that science has been piling evidence in the past years. And still, those arguments haven't been so effective to orientate policy. So we kept thinking, and the team did a great work on that because we're like multi-putes from science, and we gather a lot of aspects that can bring this subject together to ask if there's also a role being played on human health. And we had some initial signs of it, like highlighting some previous studies. And from all these teams that also had some experience to also think about that. So we then gathered everyone in one table in very, very gratifying and rich discussions. And I really think that one of the most important highlights of these studies is that we got so many important perspectives on the table about the Amazon. We tried to gather as many countries involved, and I think we did in so many important areas. We have a health scientist on that. We have a social scientist that can also talk more specifically about some particularities of over indigenous people in their country. So this was a good effort to try to compile and to deliver some knowledge over those roles that indigenous people play in health. And of course, there's another complicated layer. There is a change in environment, and that we already know that the Amazon has so many important services, benefits to people that the forest provides when standing. But it's not only standing, because it matters how is the forest. So we also aggregated some information in forest fragmentation. So not only how many forests we had, but how is this distributed? How many edge does it have with other sorts of land uses? And with a good set of data, huge actually, effort from this great team that we had the chance to gather. So we could get this 20 years of data, rich data sets that we got it out as well. Some weeks before study came out, this study that we're talking about, we were able to publish the data set as well. So more questions can be asked about the evolution of health in whole Amazon. So 20 years of over 20 diseases in the Pan-Amazonian areas. We got this message that indigenous people play some kind of role in forests, how they take care of these forests, also can provide benefits over people's health, not only them, but also people that are elsewhere. interesting, and even more interesting if we take a look at what kind of indigenous territories we mean. And we saw that if this was with lands right guaranteed and protected, if their governments recognized these lands, these benefits were even more clear. Yeah, this was one of the best outcomes we could expect. And we're very happy to share that to the world and keep asking more questions and digging more into this.
It sounds like you measured several different things. You measured air quality because the forests were not being burned, and what are known as vector-borne diseases because when the forests aren't damaged, there are fewer mosquitoes and other pests to carry diseases, and that got a little complicated. We're not going to go into that so much, but you need a certain amount of preservation of the forest cover for that to work. But can you talk about what sort of diseases you looked at?
So we look at two, let's say, big groups of diseases. So we have the fire-related diseases that can be like respiratory and cardiovascular diseases. And we think that those are somehow related to the amount of pollutants people are exposed to that are released by forest fires. And then we have the zoonotic diseases that are those diseases that are transmitted through animals. So, for example, mosquitoes, as just mentioned, and all those diseases, somehow they are related to the forest. So we did not consider diseases like dengue, which the vector is more related to urban areas, for example.
And this is because when you have a broken forest edge, right? There's some forest, but it's not entirely urban. For some reason, this is a really good area for the bugs to live, right? And so you either want really thick forest or you want a pure urban environment. When it's half and half, somehow that's better for the bugs.
Exactly. It's because deforestation, the degree that you lose forests or the degree that these forests are not well preserved, but this alters the niche of the vectors. Well, actually, for the host and the pathogens as well. So this messes up the community composition, the behaviors, the movements, and the whole spatial distribution. This is what we already know from previous studies. So how the effect of deforestation in changing these landscapes can actually change and make you expect to change the risk of these diseases. That is why we can directly think the forest integrity, how preserved it is, that it can play a better role on containing this risk of diseases.
So does the reason for preserving the forest matter? Does it matter if you're preserving for the people or just for the sake of the forest?
Yeah, this is something that we couldn't directly test, but this is where our interpretation and discussion of the results go, because we couldn't put in the same study how better indigenous lands are managed compared to other source of protection, protected territories such as reserves and other sorts of it. Well, Brazil has plenty of this mapped data that we could have, but in the broad scale that we tried, we couldn't get into that. But left over to grow forest, it doesn't do as well as when there is indigenous there. And we tested forests elsewhere, and this wasn't that well as including indigenous forests in the model. So it helped explain better than other sorts of forests in general.
Yes. So one way like to illustrate that is, for example, we know that deforestation rates are lower within indigenous lands, and that results in less forest fires happening. And we also know that the pollutants released by forest fires, they travel like thousands of kilometers, they know no borders. So of course that will impact not only the people living within indigenous lands, but also people living very far away from indigenous lands.
And that goes perfectly into my next question, because how far away do the benefits go? Were you able to measure that? Does it go as far away as, say, Lima in Peru, which we know is very far away from the Amazon, or Sao Paulo, where you are in Brazil? Do the benefits extend that far?
What we saw is that we analyzed only the Amazon scale. So we can say as far as São Paulo, but we can't expect that. Well, as we know, when, for example, the opposite, when forest fires happen in the Amazon, we have this reflected in São Paulo. I believe I was here 4 years ago when high season of fires, actually in this time of the year, was happening. We got darker at 3 p.m. in the afternoon, which is not at all common in Brazil. And this was directly related to fires there. We can also expect these benefits to travel as well, in hope, of course. So as we saw that at least forest pollutants can travel at least 500 kilometers, as our models showed,
This is quite similar with the zoonotic diseases because they go like the spillover can be very fast and also it can travel. And we have seen that more or less recently. I was mentioning the COVID. It goes like from zoonotic diseases can spread very quickly.
Can you tell us about some of the indigenous people whose land is being preserved and what it looks like?
I am working in the Brazilian Amazonia now for about 15 years. And one of the places where I used to work and I still work is a hydroelectric reservoir, a very big one. And in that area, before damming, there was two ethnic groups living there, the Waimiri and the White-throated people. While I was doing field work, I used to find the ceramics left there, and I used to feel quite bad because they have been displaced, so the dam could be constructed. And they were displaced, so they were two separate ethnic groups, so the story is quite sad. And they were displaced, and now they live together, so they are the Waimiri authority people now. So the indigenous land is very close to the place where I was working, and sometimes I used to see them moving from one side to another side. And the people who were working with me, the field assistants, they were mostly fishermen, local fishermen, and the way they speak about the indigenous land there was that they were so afraid of going there, but there were so many fish availability was higher in the indigenous land than elsewhere. So they were very tempted to go fishing there, but then they were very afraid of being kicked off by the indigenous people. So they were kind of really respecting the indigenous land because indigenous were indeed protecting their lands.
And this is interesting because I think to the outside world, I don't think people understand the number and diversity of different groups of people that live in the Amazon. How many different groups are you talking about?
In total, we are talking about 33 million people living in the Amazon biome.
And 350 ethnic groups. So it's quite a lot.
And back to the study itself. This is hard to demonstrate. You all did the hard work needed to do it.
Yes, I hope we did. This was like a huge effort, since data effort and since from temporal and spatial scale, this is a big effort that we had to do to get these answers. And the data now is public, so future research can take a look at it if one aims to research on the evolution of health in the Amazon for at least these past 20 years. And this was not an effort that we had before that could compile in a pan-Amazonian scale. And it's good to think that we sort of encourage the future efforts to keep, growing this data so we can keep doing research like that. We see that having these indigenous lands, it's not enough. And solid legal protection, enforcement of these rights matter, but also we talk about different sorts of forest cover and landscape structure as well. So we talk about effects of fragmentation too. Some way to say is that protection may only work if we're talking about forests that are good taken care of. We could expect, of course, that more intact forests would deliver better these benefits over health, but these non-linear trends and all these complex components that we included and we found different answers from one to one are all very interesting things that we raise some knowledge on.
And when you say nonlinear trend, in simpler language, that means a little is good and a lot is better. You don't mean that. What you mean is you have to get to a certain point before you get a good effect, right?
Yeah, this is a good way to say it. So, for instance, if forest it has a lot of effects of fragmentation and a low forest cover, what we found is that health benefits may decline. And in some cases, the disease risk might even increase. So we're talking that there are different directions of this trend. So it can change. So when we talk about non-linear, it's not only linear, just goes up or go down. It's either beneficial or not. No, it can change if you're talking about the graded landscape or not. It's not long ago, actually. It was very long ago. 10 years ago, I was in my master's doing field work in the Amazon and in the same forest that I was collecting in one day. In the next month, we came back there to collect again. And there was no more forest to step into. And there are a lot of fire scarps. And this was terrible. And we see people, not only indigenous, like we're talking about the data that we have on general people that went to the health centers in the city, getting sicker and sicker. And of course, the people that work trying to stop these fires, people getting other sorts of impacts on health, like directly taking care of these fires. So I think there's not only a very broad health benefit message here, but we also see this people that are closer to forests in more local message too. We can talk about vulnerable populations and everything. It's really interesting to be not only closer to the climate discussions and international debates, such as the COP30 that is coming in Belém, Brazil, but also these yearly effects that we see of the forest burns in the Amazon and how can that travel distances and be here. Let's try to keep forests as filters of air pollution and also not boosting the disease spread of zoonotic and vector-borne diseases.
Júlia, Filipa, thank you so much for joining us.
Thank you.
Thank you.
Listeners, if you enjoyed this podcast, please share it. And please look at the website at onehealthtrust.org for more on this and other interesting subjects. And if you have ideas for topics you'd like us to cover, please share them at owh@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.